Dr. Nelson, along with Pastor Dennis Shepard at United Methodist Church. A lot has happened, Pastor Shepard, since our hiatus.
Yes.
And the biggest thing is our health care.
Yes.
In this country. The health care plan was launched in early, November 1st? It was launched on November 1st?
October 1st.
October 1st. Yeah. And it's been a thrilling 2 months, to say the least. I'm curious to know how many listeners have been able to go online and get their health care coverage. There's been a lot of problems with the website and a lot of argument over whether or not this is going to work and what it's going to cost and whether or not it really is going to insure the uninsured. The one thing I found interesting about this entire discussion over health care was that the reality is 65% of health care, most Americans, 65% of Americans are covered by what? If you had to guess, what would you guess the answer to that question is? Medicare, Medicaid, TRICARE, and veterans benefits. So roughly 6 out of 10 people, close to 7 out of 10 people in this country are covered. The uninsured was the issue, and that's the reason why the president and the Democratic Party took on this this huge task of trying to insure the uninsured. 45 to 50 million Americans are without health care. And the objective was to cover the uninsured so that it would essentially bring down health care costs, because when people don't have health care and they have to go to the hospital, they have to have surgery, that surgery, the cost of that surgery is offset by the rising cost on health care on everybody that does have health care coverage.
And when they want to see a doctor, Dr. T, they went to the emergency room,
right,
which caused the price to go up. There were a number of factors that had to be contended with in this issue. The first factor, of course, was the fact you had a significant number of people who were uninsured. I've seen the figures run anywhere from 36 to 48 million people. Now, of that, of course, there are approximately 6 million who are young people who prefer not to spend money on insurance. They could afford it, they just chose not to get it. But that still leaves, if you went with the highest figure, 40 million people without health care coverage. That was one factor. A second factor is that as you just said, a number of people are covered by other things. And along with what you just said, Medicaid, Medicare, veterans benefits, and TRICARE, you also have people who are covered by their own employers. For example, in North Carolina, state employees are covered. Right. And have, up to recent times, that's been paid for by the state. I think they're shifting some of that cost to state employees now. But you had those folks that were already locked into a group. But another factor was the high cost of health care, because of the fact you had people going to emergency rooms who didn't have insurance, and the hospitals haven't spread that cost out, so they raised everybody else's cost. Right. When you and I would go, our insurance had to pay a higher cost, and we had to pay more out of pocket for it. That was a factor. Then another issue is the component parts of the cost of health care itself, like pharmaceuticals had become a bigger component of our health care, and they're expensive. Right. I was at the drugstore one day, and a gentleman in front of me was getting a medicine for his wife, and it's a high tier. There are several tiers the way medicines are done, and the newer the medicine, the higher tier it is, the more expensive it is. Well, he was getting a medicine for his wife, and his copay after insurance was still $175. So the medicine was a big problem. And then you also had the fact that now doctors are relying more, running more tests, for one thing, to protect themselves from malpractice claims and that kind of thing. So all those things are factored into the cost of health care in this country. Now, it would have been, you would think common sense would say, well, let's look at what are some possible solutions here. And one would have been to expand Medicaid, Medicare, and ask the pharmaceutical manufacturers, the hospitals, the doctors, and people who could afford to pay to put some money into that to help offset it. But the problem has been, because of the high cost of health care, Medicaid and Medicare are exceeding their budget limits. And that's one of the areas in the government that's spending more than it's allocated, because so much of it has to be spent. Well, that was a big issue. So they looked at it and came up with this plan, which is called the Patient Protection and Affordable Care Act, otherwise known as Obamacare. And it was simply a way of trying to make sure that everybody had access to this insurance. Well, they ran into some problems with it. First of all, nobody realized how many policies out there did not meet the standards that were required under this act. And that's why a lot of people have had their insurance canceled or are going to get it canceled. My daughter, for example, we had a policy on her because she aged off of ours, and her policy has been canceled because it doesn't meet that standard. Well, when I looked at it, what will happen is they have three alternatives. You got a bronze plan, which is 60-40.
Right.
You got a silver plan, which is 70-30 or 80-20. I forget which now. But anyway, it pays more. And then the gold plan pays the most. But they're more expensive as you go up that scale.
Right.
So to replace the plan, the coverage she's got now, which was $164 a month that we were paying, we're going to have to pay $300 a month. So along with getting your policy canceled, people are going to be paying more money. Another thing they've done is they have required coverage that people don't normally need in order to help reduce the cost of that coverage for people that do need it. For example, there was a couple on television week before last who were both 60 years old, and they're getting a new policy, but they've got to have maternity care. It's required under this act. And they don't need it. They're 60 years old. But it's to help lower the cost for maternity care for couples that do need it, or people that do need it, who are the age of childbearing years. So those are issues that nobody thought about in advance. Remember, this bill was over 2,000 pages long. Nobody had read it. They weren't aware of all these things. And then, of course, the big boo-boo was the website. By the way, that website cost $174 million to launch. And as you know, they had all kinds of nightmares, because anytime you launch something of this magnitude, you're going to have headaches. You can't get around it. Right. Now, you know, they tried to get all the states to participate and do their own exchanges. And the states that did do that have had relatively few problems. We don't know exactly how many people have signed up through the states because they haven't released all that information. We do know that through the federal exchanges, US.gov is 125,000 people as of November 30. That number should rise shortly. Many people, it's estimated that 9 million more people will be on Medicaid as a result of this. And it's also now coming through that in reaction to it, there are some other problems that nobody foresaw. For example, the Cleveland Clinic, which is the #1 hospital in America, has indicated it will not take anything less than a silver plan. It will not accept insurance less than a silver plan. Many doctors now are refusing to take Medicaid, Medicare patients because their reimbursement is so low and takes so long to get it. So there are some additional headaches with this thing that are going to have to be worked out. So it is a humongous nightmare. All the states did not get into it, Dr. T.
Right.
They should have. As much as I want to fault the states, the federal government had that burden, and they should have sat down with the states and said, here's what we're going to do in order to get this thing worked out. We're going to make a 10-year commitment. We're going to fund this thing for 10 years. After that, we'll start gradually decreasing the amount. But give us 10 years, we'll have this thing in place. State exchanges would have worked better. It didn't happen, unfortunately, and so we're battling this boondoggle, this albatross. And
well, if it was just a matter of money, it would be an easy solution.
Oh,
And
yeah,
it
not a
doesn't
matter of
seem
money.
like, no matter how much money you throw at healthcare, it doesn't seem like it seems to ever get any better. The
Nope.
reality is, according to the internet, the U.S. stands as the 50th in the world in life expectancy. The CIA World Factbook ranks the United States as 174th worst out of 222 countries in infant mortality and healthcare, 6 deaths per 1,000 births. A study found between 1997 and 2003 preventable deaths declined more slowly in the U.S. than in 18 other industrialized nations.
Right.
The U.S. spends more per capita per individual insurance in this country than any else in the world. The average family is looking at an average of $9,000 to $10,000 per year for health care costs.
Right.
So, obviously the system isn't working, and the real problem is, how do people find better jobs? How do people have their median income increase?
Right.
How do we have a productive company, productive country where we can afford health care for our workers? I mean, that's really, years ago, you used to get when you had a job, one of the benefits was health care benefits. But more and more small businesses have been unable to provide those benefits because of the extremely, raising cost of the insurance industry upon small businesses.
Yeah, you're exactly right, Dr. T. And by the way, insurance for females, even before all this happened, was more expensive than it was for males.
And wait till you get to 50, too. I mean, once you get to 50, it jumps.
It jumps considerably.
So the health care...
But I know with my children, when we got insurance on our son, it was cheaper than insurance on our daughter. And neither one of them had pre-existing conditions or anything that would have caused that to happen.
Right.
But when I asked the insurance agent, he said, well, insurance for females is more expensive because of the maternity issues you just mentioned. So if you are an employer like you are and you have a number of female employees, obviously your insurance is going to be skewed by that because the insurance providers look at your census, that is the number of people you're covering, and age and sex and so forth factor into that as to what the rates will be.
It got to the point where the employees didn't want the plan because it was so expensive. And they were paying, I think we were paying, it was 60-40 or 70-30.
Yeah.
And they would complain that the rates were going up. And I would tell them, we're not increasing the rates.
Yeah.
It's the company that's, the insurance company, the carrier's increasing the rates. And as you know, even if you go to the North Carolina Exchange, there's only two choices. Nothing's changed with regards to competition.
They should have gone in and done a uniformity so that across this nation, any insurance company that met the specifications, for selling insurance, just like the auto has to in this state, could sell it in any state.
Right.
More competition would have meant lower rates.
And why do you think that that's not available?
Because what we learned is because some of those companies have big lobbyists.
The industry decided years ago that they would choose different parts of the country to serve it. And so the companies decided they wouldn't compete with each other and they would pick and choose what parts of the country that they would control. Right. Sounds like a monopoly to me. I mean, it sounds like something that you would think a company would be unable to do. So when you discuss this issue over healthcare, I don't give either party a break here because both parties know and knew what the problem was. That there was a controlling factor here, controlling healthcare. Yeah. And honestly, what do we have at the end of the day? Let's be totally honest. I looked this morning to see if I could get a comparable or break on my own health insurance, right? Mm-hmm. It's about the same, only the deductibles are higher. It may be $75 or $100 cheaper per month for myself, but I've got a $5,000 or $6,000 deductible if you look on the website.
And you're going to be paying more for your prescription.
Right, but when you look at the company that's servicing it, it's Blue Cross Blue Shield. Yeah. Nothing has changed, folks. I mean, some of the things that have changed. Okay, so if you have a child, he can be on your health insurance until he's 25, getting through college. That's a good thing. If you have who knows how this is going to go. But I'd like to see the amount of people that were denied coverage because of pre-existing conditions, and hopefully they're going to be able to get coverage now with this. That's a good thing as well. In fact, how many people will go on the plan? How many of the uninsured will go? I don't know. But it looks like to me that all it was an offset of the insurance companies offering smaller plans with higher deductibles. Mm-hmm. I've got people that work for me that have tried to get insurance. They weren't able to get on the website for the first month and a half. But honestly, it's not much different than if they just picked up the phone and called and asked a broker to get them health insurance. Yeah, the
other thing that's different, Dr. T, is that the government did tell the insurance companies what the minimum standard would be. Mm-hmm. Prior to this, the insurance company could set the minimum standard. Mm-hmm. They can't do that anymore. The government has said, got to meet this standard, and that's why so many policies are being canceled, because they didn't meet that standard.
Right. Well, maybe that's for the good. Maybe there was some policies that really weren't very good.
They were referred to as junk policies, but most people had them really to offset if they went in the hospital. Mm-hmm. That's really almost like catastrophic coverage. And so,
well, we know that it's not often that the government gets involved and anything really gets solved in this country. I mean, it just doesn't seem like these days there's much we can do correctly. Yeah. I'm Dr. Nelson. You're listening to Tuesdays with Dr. T alongside Pastor Dennis Shepard. We're back in action every Tuesday at 9 o'clock in the morning along with Chuck the Engineer Extraordinaire at WIDU on the Wake Up program, and we'll be right back after these messages.
Nelson and Nelson Chiropractic Center, serving Cumberland, Lee, and Robeson County, including the greater Cape Fear Valley region, all with no waiting, minimal paperwork, advanced treatment techniques, and expert doctors and staff committed to providing the very best in chiropractic care. Voted #1 chiropractors in the Fayetteville Observer's Reader's Choice Awards. Nelson and Nelson Chiropractic Centers, committed to our profession, our community, and putting our patients first.
This healthcare situation just seems to be getting worse. I don't know if it's going to get better.
Well, that's exactly what the federal government was set up to do originally when they were arguing over being a federal government or not, the Federalist, anti-Federalist. One of the things they all pointed out and agreed to was the federal government was supposed to provide for common defense, make sure that commerce was free and open among and between the states, and make sure that the regulations are there for the benefit of everybody. But what happened is that the federal government has largely turned into an administrative body rather than a decision-making body, and taking care of the laws and that kind of thing. So it's become administrative, and sees more and more that. Well, when you become administrative, you don't fix problems; you react to problems. Okay, because you're not being proactive; you're being reactive, and that's what's happened over the last 50 years, and it's sad.
And things only seem to be getting worse.
They are getting worse because what happens is when you become an administrative body, guess what's deriving that? It's the agenda. And you got an agenda on one side, an agenda on the other side, and an agenda in the middle. And you got corporate interests who have agendas in there. And that's why you don't have the regulations you're talking about, or the labels on the products and that kind of thing, because they have an agenda and they got money, they can influence the government. So it's sad that what was envisioned to be a wonderful thing has morphed into what we have today, which is a real nightmare. I was reading a thing the other night. An article about this very thing, and here are some interesting quotes from people you might find very interesting from history. Noah Webster, you know him, he said, "There is no nation on earth powerful enough to accomplish our overthrow in America. Our destruction, should it come at all, will be from the inattention of people to the concerns of their government." Alex de Tocqueville, the French philosopher who came and studied America, said, "The American Republic will endure until politicians realize they can bribe the people with their own money." Ben Franklin said, "When people find they can vote themselves money, that will herald the end of the republic." And Barry Goldwater in the 1960s said, "A government that's big enough to give you all you want is big enough to take it all away." So those are some interesting quotes. Also, Alexander Tyler said, "A democracy is always temporary in nature. It cannot simply exist as a permanent form of government. A democracy will continue to exist up until the time that voters discover they can vote themselves generous gifts from the public treasury. From that moment on, the majority always votes for the candidates who promise the most benefits from the public treasury, with the result that every democracy will finally collapse due to loose fiscal policy, which is always followed by a dictatorship."
Yep. Well, that's something that has to be considered by most Americans, and we have to start taking active action, and I think it starts with your elected representatives, and I'd like to see more independent candidates arise and run for office. And I think that people that are out there that are farmers and school teachers and pastors and should run for office in this country, because the people that you find running for office often are making it, and I've said it before, are making it a career. And there are no term limits besides the president. Everybody else can run from here to kingdom come. I mean, they can stay there and often do stay there for 20 or 30 years or longer. And it doesn't seem like, we're the beneficiaries of that longevity.
Right.
I mean, it just doesn't seem like any of the problems that are core to our problem are getting addressed. And the health care was one part of our bigger problem. And, of course, our bigger issue is that there's not enough money coming into the government for all the needs that we have and all the bills that we have. It's like a household that has 10 kids and only has so much money to pay for 5 kids. And they have to borrow the difference to pay for the rest to keep the household going. Right. And they do that over the course of 20, 30, 40 years.
We're almost up to $19 trillion in debt now.
And they build up this tremendous amount of debt, and then they're beholden to the indebtors. Who are the guys that hold our debt? The Chinese hold a third of it, right? So why are our trade policies so lackadaisical with regards to the Chinese? Well, they own our debt. So it's a situation that we put ourselves in, but we don't seem to be discussing those issues. And then we get to a problem that we really have to solve, which is the uninsured Americans. And how do we go about doing it? One side claims they have a better policy than the other. This goes back and forth. There's no compromise. What they come up with is something that one party or half Americans don't like, the other half do like. And at the end of the day, it's just a policy. It's just more extended policies for the insurance industry. It's not that the government is paying for this. It's going to be more of the American people are going to pay for the policies because it's additional policies at lower rates monthly with higher deductibles and higher premiums down the road. That's really what it amounts to. There really hasn't been any change.
Another example, Dr. T, of the government being administrative and failing to do its duties, we haven't passed a budget in this country in years.
Right.
It's the way they fund the government now is by resolution. And so every 6 months they have one of these fights, gridlock in Congress, and they end up, when the political pressure starts getting applied, people afraid they might not get reelected, they give in to each other and they pass another resolution and fund the government for 6 more months. We're going to see it happen again the end of January, February. They're going to have to do the same thing just like we saw last fall.
Yep.
This is sad.
Yep, and it's part of the continued expenses to the country. We've only collected, I think, what was the figure, $2.5 trillion in taxes, but yet we have something like $4 trillion in expenses, and healthcare is a big part of that. Medicare and Medicaid, almost $1 trillion tacked onto that bill.
It is.
I don't know. I don't know what your experience has been on the website. I did go to the website. I told you I found plans that are comparable to what I have right now. So I don't know if the uninsured are going to be able to really afford what's on the website. I hope that they are, but I'm not so sure that that's going to change anything. And what are the diseases that Americans are dying of? You want to take a guess?
Heart disease, cancer.
Right? 1, 2. Right? Diabetes. The causes of diabetes are on the rise. That's what's killing most Americans.
Yeah.
Plus, we have an aging population.
Right.
That's more cost. They say that most of the cost in the last 10 years of your life, that's where most of the cost is for most Americans because of the extended time of hospitalization. The average hospitalization in this country is $10,000 per individual. So that's for a general stay. I don't know if that includes the surgery or just the cost of the bed.
That's just the cost of the bed. Yeah.
I know in my own family, when my uncle was diagnosed with cancer, most of that, I'm sure most of the cost of Medicare was in the last 3 or 4 years, because that's when most of the procedures were performed, the extensive amount of surgery, the amount of time that he was in the hospital, the amount of medication he was taking, etc. So are a lot of our diseases preventable? A lot of them are preventable. Nutrition and diet and exercise are 3 top ways of addressing some of the problems with regards to our health care. But the cost of medication is also going up. The cost of medications in this country, with regards to Medicare, are not on the open free market. I was reading about Medicare Part C, the last part of that in the last of the Bush years, where there was an extension of $800 billion, but yet the government is restricted from fairly shopping for better prices for medication. Now, why is that? Sales of the nation's 2 most popular prescription painkillers have exploded in parts of this country. Over in New York, the drug enforcement agencies have dramatically seen increases from the last 15 years in medications like Percocet and Percodan, OxyContin, Vicodin as well. The distribution of hydrocodone and the key ingredients in Vicodin are exploding on the open market and black market. And a lot of teenagers too. Number one, now it's risen above car accident deaths with regards to teenagers as prescription drug overdose. Not even illegal drugs. Kids are breaking into their parents' into their parents' medicine cabinet and stealing those drugs. And
parents and grandparents and aunts and neighbors.
80% of all painkillers are consumed. 80% of all the painkillers in the world are consumed in this country, and we represent 8% of the population, the world's population.
And here's something freaky: most insurance policies before this, and I don't know how Patient Affordability Protection Act changed this, but I do know this is true. Prior to this, most healthcare insurance would cover painkillers of any type, but would not cover birth control pills. Well, and that's one of the things that they address with it. So
absolutely crazy. We're back to discuss the craziness. Can we come up with solutions? What are the solutions to these problems? I'm Dr. Nelson, alongside Pastor Dennis Shepard, and we'll be back with Tuesdays with Dr. T on the Wake Up program. Robert Curry, are you out there? Can you hear me? We're back. Clear.
Nelson and Nelson Chiropractic Centers, recognized for more than a decade by their patients, community, and colleagues for true dedication. Winners of the Fayetteville Observer's Reader's Choice Award for Best Chiropractors, Up-and-Coming Readers' Best Chiropractors, Methodist University's Small Business Excellence Award for Community Service, and the North Carolina Chiropractic Association's Member of the Year. Nelson and Nelson Chiropractic Centers, truly working overtime to make a difference in our community.
Forget the healthcare situation. The reality is that we've got close to 50 million Americans living in poverty.
Yep.
The Bureau reports income poverty and health insurance coverage in the United States in 2011 showed that the number of people living in poverty in the U.S. is 46 million people.
46 million.
Although the figure was not statistically different from 2010 at 45 million, it reversed a trend of growing poverty numbers in the past 3 years. However, the government regulates poverty, the degree of poverty, as $23,000 per family below the $32,000. I'm sorry. The federal government set the poverty threshold for a family of four in 2011 at $23,000.
$23,000.
I mean, are you kidding me? I mean, there's got to be a better way. And I just don't understand why the government, in that circumstance, says, how do we repair a city like Detroit? What do we have to do to incentivize these companies? What can we do to reach out to the American industrial complex, the companies in this country, and get them to come into cities like this, go into cities in Lumberton and Robeson County and rebuild and put a factory there that's making products, American products. Instead of over in China, a Nike sneaker that retails for $350. For a family of four, the mother's got to buy this sneaker for her son. Where's it produced? It's produced over in India or China, right? Where it's where a working class of children or young or poor, impoverished people are making products and are suffering, in these sweatshops over there. It just doesn't seem like it's fair. It doesn't seem right.
And that's because, Dr. T, that Americans have an affinity and almost obsession with getting things cheaply. I don't know if you saw the news reports, but on Black Friday, there were fights breaking out. And people were trying to get into Walmarts and other places and get products ahead of somebody else that were cheap, that were on super sales. So we have an obsession with that. So,
the cheap products are one thing. They are one thing. Look, cheap products are great, but at what expense? In other words, I think if you gave people a choice and said, would you like a job making the sneaker at $22 an hour plus health benefits and a retirement package that you pay into for 25 years? Would you like that, or would you like a cheap sneaker? I believe people would choose the good job with the benefits and the health benefits in this country. I believe that in that case, protecting the American people, looking out for the American people, in that case, then government can work as opposed to what we have today. It's just a mess, and we'll discuss more of this in the coming weeks. I'm Dr. Nelson. You've been listening to The Wake Up Show. Yesterday's a canceled check.
Tomorrow's a promissory note.
Today is the only time we have, so spend it wisely. Dr. Nelson signing off. God bless you. See you next Tuesday at 9 o'clock with Tuesdays with Dr. T on the Wake Up program. Take it away, Chuck.
God bless everybody.